I'm Dr. Bryn Austin. I'm a professor at the Harvard T.H. Chan School of Public Health and Harvard Medical School. I'm also the director of STRIPED, the Strategic Training Initiative for the Prevention of Eating Disorders, a public health incubator. STRIPED, which is based at the Harvard Chan School of Public Health and Boston Children's Hospital, is a program designed to train the next generation of health professionals to bring the power of public health to prevent eating disorders. In the field of eating disorders prevention, a big concern of ours is the use of dietary supplements, especially those sold for weight loss and muscle building. These products can cause serious injury and even death, and they can be especially troubling in the case of eating disorders. More on that later. As clinicians, you should be concerned about these products too. Many clinicians may not realize just how common it is for patients to use these products, but they never mention it to their clinician. Adults, teens, the elderly, even babies use supplements. People from all racial, ethnic, income, and education groups, people of all body shapes and sizes, across the spectrum of sexual orientation and gender identity, immigrants and U.S.-born alike, pretty much every group uses these products. In fact, over half of American adults report using them. In this brief video, I'll go over some crucial information about dietary supplements to help your patients stay safe and healthy. I'll focus especially on those sold for weight loss and muscle building, including their link to eating disorders. I'll end with some recommendations for how to talk about dietary supplements with your patients in your practice. So what is a dietary supplement exactly? The U.S. Food and Drug Administration, or the FDA, says that a dietary supplement is a product intended for ingestion that contains a dietary ingredient intended to add further nutritional value to supplement the diet. This includes everything from multivitamins to melatonin to fish oil to pine pollen, promising an improved sex drive. These products are everywhere. Rows and rows of them line the shelves of our pharmacies, grocery stores, and gyms. In the U.S. alone, the industry generates $37 billion in revenue and is growing. As I mentioned already, over half of U.S. adults take dietary supplements, and nearly half of all adolescents report using them too. These products are easily accessible, but hardly regulated. Why? Because of a federal law passed in Congress in 1994 called the Dietary Supplement Health and Education Act, or DSHEA. With this law, Congress more or less tied the hands of the FDA so that it could not require rigorous pre-screening for safety or efficacy of supplements like it does for over-the-counter and prescription drugs. Because of DSHEA, the FDA often finds out about tainted or dangerous products only after reports of outbreaks of injury or deaths. Tragically, serious injuries and deaths do happen because of these products. A 2015 joint study by the FDA and the Centers for Disease Control and Prevention, the CDC, found that dietary supplements lead to over 23,000 emergency department visits every year. Another study found that reports of supplements to poison control centers increased 50% from 2005 to 2012. These cases are too often life-altering or even life-ending. Take, for instance, the case of Christopher Herrera. In 2012, Christopher was an ordinary 17-year-old boy from Texas who thought he should lose some weight. So he bought a concentrated green tea extract at a nutrition store thinking it could help and assuming it was safe. Sadly, after using this supplement, Christopher ended up in an emergency department and was hospitalized with severe liver damage. The doctor who treated Christopher said that his chest, face, and eyes were, quote, almost highlighter yellow, and the doc said the damage was so severe that he was put on a waiting list for a liver transplant. Tragedies like this are all too common, but the FDA is forced to act only in reaction to tragic stories like this one, rather than being able to do much to prevent them from happening in the first place. For instance, in November 2017, the FDA issued a warning about the herb kratom and supplements containing it. But this warning came only after the herb, which some consumers use to self-medicate depression and symptoms of opioid use disorder, was linked to 36 deaths. Even some supplements that most consumers mistakenly think of as harmless have been tied to serious health consequences. For example, St. John's wort. Many people take this supplement for mild depression, but it can interfere with prescription medications, including both contraceptives and drugs used to treat HIV. Clearly, if any of your patients are on hormonal contraceptives or HIV meds, you're going to need to know right away if they are also taking St. John's wort or other supplements on the side. But this is only part of the story. In addition to some herbs being dangerous by nature, there are other types of supplements that the FDA has repeatedly warned consumers about because of unscrupulous manufacturers adulterating their products with dangerous ingredients. Top among these are supplements sold for weight loss and muscle building. Dietary supplements for weight loss and muscle building have been linked with organ failure, testicular cancer, heart attack, stroke, and even death. Some supplements have been found to be adulterated with illegal substances such as steroids, prescription pharmaceuticals, even banned pharmaceuticals like fen-phen, and heavy metals. Some manufacturers have even added slightly altered chemicals to their products so that compounds previously identified as dangerous are not detected. On top of all this, supplements for weight loss and muscle building pose a particular concern in the case of eating disorders. The use of these products may be considered an unhealthy weight control behavior, which is one of the diagnostic criteria for some eating disorders. In some cases, the use of these supplements can be an important sign that a patient is struggling with an eating disorder. Clinicians can respond by making appropriate referrals. In other cases, they may present an opportunity for early detection and intervention for patients who are in the early stages of developing an eating disorder. Unfortunately, the use of weight loss and muscle building supplements is common. Earlier, I mentioned that dietary supplements account for over 23,000 trips to the ED every year in the U.S. Weight loss supplements account for fully a quarter of these visits. While young adults ages 20 to 34 are the hardest hit, use of these supplements is common among even younger people. A national survey found that 11% of teens had ever used a weight loss supplement. In the same survey, 5% of teens had used creatine, one of the many dietary supplements sold for muscle building. And for young people ages 5 to 19, weight loss supplements are the most frequent kind of supplement sending them to the emergency department. The dangers of dietary supplements have become increasingly well known, especially after the high-profile deaths of 2 active duty service members on a U.S. military base in 2011. The soldiers, one of whom was 22-year-old Private Michael Sparling, had been using dietary supplements containing the product DMAA. The soldiers died of cardiac arrest during physical training. The sudden and avoidable deaths of these soldiers, along with others' injuries due to similar supplements, prompted the Department of Defense to step in to protect our nation's soldiers from these dangerous products. In response, the DoD launched Operation Supplement Safety, a health education initiative to keep soldiers and their families informed about the dangerous consequences of dietary supplements. The DoD took steps to protect America's soldiers, we can do the same to protect all our patients too. There have been efforts by other change makers as well. In 2015, 14 U.S. state attorneys general joined together and submitted a letter to members of Congress. They asked for greater FDA regulation of dietary supplements and pointed to documented cases of contamination of these products, as well as mounting concerns about safety and efficacy. People are starting to work on the state level too because of the slow response from the FDA. My program, Striped, is working with Massachusetts State Representative Kay Kahn to push through new legislation. Representative Kahn and 20 other co-sponsors recently filed House Bill 1195, an act protecting children from harmful diet pills and muscle-building supplements in Massachusetts. If this bill is passed into law, the state would prohibit the sale of these products to minors and require retailers to move them behind the counter, as we already do with other harmful products like tobacco. The medical community is taking action too. Doctors at institutions like Harvard Medical School have published extensively about deceptive claims of miracle weight loss solutions. Also, because so many teenagers have used weight loss and muscle-building supplements and been hurt by them, the American Academy of Pediatrics released 2 reports in 2015 warning about the dangers of these products and cautioning against teens using them for any reason. As clinicians, you work hard every day to keep your patients safe. That's a given. You can also play an important role in protecting your patients from harmful supplements, especially for people living with or at risk of eating disorders. The first step is to begin open, informed conversations with your patients about their supplement use. A 2008 article published in the American Journal of Medicine suggests a 6-step process for speaking with patients about their use of dietary supplements. 1. Ask about supplement use and the reason for using it. Patients usually will not offer information about supplement use unless they are asked. Some clinicians feel uncomfortable asking about supplements because they haven't been given much information about them. It's important to be clear with patients about what you know, why this conversation is important, and how you can help them to make informed decisions around supplement use. The beginning of that conversation might go something like this.
And do you smoke cigarettes or use any tobacco products?
No.
How about dietary supplements? Things like vitamins, creatine, melatonin?
Yeah, I take vitamins sometimes, just those normal once daily ones.
Okay, anything else? Some people take supplements for weight loss, muscle building, or mood. Anything like that?
Yeah, I just started these green tea pills to lose weight. I'm trying to lose 15 pounds before my friend's wedding in June.
Do you know the name of the product or the brand?
I can't remember right now. My mom takes them too. I can ask her. I'll text her.
Okay, while you get that information, I'm happy to help you do some research to see if it's something you want to continue. I get concerned when my patients take certain supplements because sometimes they can cause serious side effects that patients are not aware of. Have you noticed a difference in how it makes you feel?
Yeah, I've been sweating kind of a lot lately, but I took an extra pill this morning, so maybe that's why.
Okay. How about I check your blood pressure while we wait for your mother to get back to you?
Okay.
2. Take patient disclosure of supplement use seriously, just like you would for prescription drugs. Seek out available resources if you're unfamiliar with a supplement. Some resources mentioned in the American Journal of Medicine article are found in this table. 3. Tell your patients how supplements are regulated.
What do you know about how supplements are regulated?
What do you mean?
So over-the-counter drugs like ibuprofen are regulated by a federal agency called the FDA. What people don't know is that supplements are not pre-screened for safety and effectiveness, the way that over-the-counter drugs are.
Oh, so there's just no one looking at what's in them then?
Well, they work mostly on a complaint-based system. So it's not often until there's an outbreak of serious side effects from certain supplements that the FDA steps in things like stroke, damage to the liver, or even death. And it's way too late to keep consumers safe.
Yeah, wow, I had no clue. Yeah, I'd really appreciate it if you can help me look into that supplement then. I think my mom just texted me back, actually.
4. Continue researching clinical trials or studies that have tested the safety and efficacy of the supplements your patient is taking or asking about. Learn about side effects and drug interactions. Along with the resources I mentioned earlier, you might consider looking through medical databases like Medline or Cinol, or maybe consulting a hospital or community pharmacist. Then discuss what you find with your patient so that they can make an informed decision. 5. Compare the risks and benefits of supplement use to available conventional therapies that you would offer instead. Share your newfound knowledge with your patient as well, and let your patient know that you're open to continuing the conversation. And lastly, 6. If your patient decides to use the supplement, monitor them for any adverse events and be sure to report any adverse effects to the FDA. You can do so through the FDA's Safety Reporting Portal at safetyreporting.hhs.gov. Also, keep in mind the role that supplements for weight loss and muscle building can play in the development and exacerbation of eating disorders. This can help you to detect warning signs of eating disorders and make referrals in a timely way so patients get the care they need. Okay, now it's time for a short pop quiz. Question 1. What is a supplement? A. Over-the-counter drugs like ibuprofen, pre-screened by the FDA. B. Food items containing words like diet or protein on the label. Or C. Products containing ingredients intended to add further nutritional value to the diet, including daily vitamins. The answer is C, according to the FDA definition of a dietary supplement. Question 2. How are supplements regulated? A. The FDA pre-screens supplements before they are allowed on store shelves. B. The power of the FDA is limited. Manufacturers and distributors of dietary supplements are responsible for evaluating the safety of products. The FDA can take action only if there's an issue once a product reaches the market. Or C. The FDA doesn't regulate dietary supplements at all. It is up to consumers alone to make informed decisions and to spread the word about harmful products. The answer is B. The FDA's power to regulate dietary supplements is limited by DSHEA. The FDA does have a portal where you can submit reports of illness or injury. Question 3. How are dietary supplements for weight loss related to eating disorders? A. Using weight loss supplements can be an unhealthy weight control behavior, which is a symptom of some eating disorders. Using them can also make existing eating disorders worse. B. Weight loss supplements are a healthy alternative to other ways that people try to lose weight. They help prevent eating disorders. Or C. Supplements for weight loss are often used by patients with anorexia nervosa, but they are not used by patients with bulimia nervosa or binge eating disorder. The answer is A. Weight loss supplements can play a role in the development and exacerbation of eating disorders. The use of these products isn't specific to any one diagnosis either. Folks at any stage of any eating disorder, as well as those without any other eating disorder symptoms, may use these products. Talking about supplement use can help you detect eating disorders early and intervene. Thanks for taking my pop quiz. If you didn't do as well as you'd hoped, feel free to re-watch this video or refer to the resources on the Striped website. In closing, a problem of this magnitude and severity requires an all-hands-on-deck approach. Together as doctors, nurses, social workers, dietitians, researchers, and public health practitioners, we must step up to help those we work with to make safer and more informed decisions around the use of dietary supplements. Through our efforts, we can help others to avoid the tragic and all too common health consequences that we've talked about today. Thanks for tuning in. For more information on dietary supplements and on related eating disorders prevention initiatives, please visit us at hsph.harvard.edu/striped.